The wildfires in BC right now, the third worst in the province's history, and there are hundreds of firefighters trying to control the flames. But of course, the effects even more far-reaching. Millions of people are feeling the effects in the air quality. Right now, it's among the worst in the world, and bad air quality and advisories into Alberta, Saskatchewan, Manitoba as well. Dr. Peter Lynn is CBC's medical contributor, and interestingly and fortuitously for us, just back from Vancouver and Kelowna, so you've actually experienced some of this air quality. What did you notice?
Yeah, it was horrific. When you look out the window, all you see this is white stuff, and you can't really see the sun. Now, I wasn't bothered too much by the irritation and things like that, but many people are talking about irritating eyes, their throat is sore, they can't breathe properly. And part of it is thinking about, let's say we're sitting around a campfire. When you have a really good fire, everything burns beautifully. There's no smoke, right? Because everything gets converted into carbon dioxide and water. But when you see this white stuff coming out, basically there are intermediate breakdown products. So you're not burning this thing cleanly. And so that's what we're breathing in and feeling all of these side effects.
So we're talking about an air quality health index as being a 10 plus. Now that's a scale that normally goes up to 10. So what is this? What is exactly being measured and what does that mean?
Yeah, so normally we're measuring sort of exhaust from cars and things like that. So they're looking at nitrogen dioxide, which is bad for your health. They're looking for ozone down at the ground level, and then these particulate matters that are very small, 2.5 micrometers. Just to give you an idea, your hair is about 30 times larger than that. So these are the things that we're going to be breathing in.
Okay.
So they looked at those three things because they're linked to health problems down the road. So that's why they gave us a scale, and it's normally we sit between 0 and 3, which is where you can do whatever you want outside. When you get to this 10, they don't want you to go outside at all, and a 10 plus, meaning that you're off the scale, so to speak, and that's when we're going to have all these horrible effects.
So what are the effects? What are, at least short term, what are we talking about the health risks right now?
Yeah, short term, very simple. You get irritated eyes, itchy eyes, you might get a sort of plugged up nose, you might have a sore throat. For people with asthma, this is when they get into trouble because the lungs become twitchy and they constrict, and now they can't breathe. For people with lung disease, so for example, COPD, or we call smoker's lungs, they can't breathe because their lung is damaged, so then now they're having difficulties. So in the emergency rooms, they're seeing a lot of those people coming in, basically not able to breathe. If you have heart disease, if I can't get oxygen into you because the air is so thick, then your heart is not going to get all the oxygen that it needs, so you might have more heart disease. Okay. And in terms of children, that's another group that we think about. Their lung to their body ratio is pretty big. Like they have lots of lung, I guess if you will, and they breathe quicker. So therefore, all these particles will go in and cause them problems, similarly with the elderly.
So this is short term, as you've said, in this way, but there's no indication these fires are going to be extinguished anytime soon. They need a massive amount of rain. I'm thinking also about the firefighters who are exposed to all of this smoke for a prolonged period of time. Long term, what do we have to be concerned about?
And that's the important thing, is because a lot of these gases disappear, but that smoke that's going up that you see from the satellite images, those are those small particles, these tiny little things that are going to get deep down into your lung. This is the cloud that's sort of spreading across the country. And the firefighters are breathing that in as well. And when they looked at them, let's say year after Fort McMurray, for example, they're following them up right now, they notice that they continue to have coughing and inflammation in their lungs. So in other words, they're not getting better. Remember when the Twin Towers came down and there was all that fine particles that the first rescuers got, and they're still having lung problems. So now as we follow people out, I think we're going to see that they have chronic problems down the road as well.
Okay. That is worrisome, too. One of the many worrisome things about these fires. So people who live in the area are, and indeed in the wider regions of Alberta and Saskatchewan, Manitoba, they're hearing this advice from many sources, but it certainly bears repeating this morning. What should a person do given these air quality conditions?
Yeah, basically just stay indoors. Look at that index, that air quality health index, and then when it's high, stay inside. Keep your windows closed. When you're driving around, have your windows up. This is a good time to use air conditioning as opposed to anything else. The other thing is, if you have medications for your lungs, make sure you have enough of the puffers, because people are running out of those things, and make sure you know which one you're supposed to use. And on top of that, people are asking about masks. Now, really, the mask that you need to use is the N95 mask, which is the really tight one, which you cannot breathe in.
Right.
And so that's the perfect one. That'll block about 95% of those small particles. The normal paper mask, probably they don't do anything, but I think people feel better if they wear it. So I tell people, if you feel better wearing wearing it, go ahead and wear it, but it's leaking on the sides and things like that.
Little placebo effect going on there.
It's not bad. At least you get rid of the big particles.
Sure.
But if you're going to use one of those masks, you got to keep changing them. Otherwise, they get wet and they get damaged, and then they get full of fungus and bacteria as well. And then finally, in your own home, some people have filter systems, like the HEPA filters, which have to clean out about 99.9% of those particles.
Okay. We're looking at a triathlon. That's the kind of thing you say you might not want to be involved in. A number of them have been canceled just in the last couple of days because of bad weather as well. Relax, stay indoors, close the windows, crank up the AC, and
that's right.
Hope for rain.
And watch TV, you know.
Well, then you get all sorts of good information from Dr. Peter Lynn. Thank you very much for coming in this morning.